and diabetes and hypertension in our younger population before they're 20. And this is going to be the first generation that's going to die before their parents. So we have another problem coming up right now, and that is our lack of focus on wellness. That's one of the deficits I see in our bill.
I got to do it again. Just to touch on what you said before, we were saying that thank you very much. The cost of health care in this country is more than in other countries where they survive longer. Unfortunately, in this country, what you say is true. We're much more obese than other countries. We drink much more than other countries. We smoke much more than other countries. We eat more. We do more drugs. Ultimately, we have to keep that into perspective. Either we tell people they can't do these things and we set restrictions on them, or we have to be aware of the fact that it's much more costly to take care of folks here than, say, Italy, where everybody's 100 pounds and doesn't smoke and drinks 2 glasses of wine every day. So, something to keep in mind.
I think it would be interesting to see what a model would look like to incentivize people to be healthy. You know, if gym membership is a whole lot less expensive than what we pay in health care. And it is the hard part to deal with health and lifestyle versus take a pill, go see your doctor, get something removed. It's a part of our society to overindulge, and we pay a premium.
That we do. Okay. If there is no healthcare reform at all, where will the money come from to pay the increased numbers of people with no insurance? In other words, if we don't make any changes, where do we go from here?
Well, it's essentially where we're at. And that is there are a few people, or certainly a segment of our population that is paying today for everyone else. That is occurring today. It's not real efficient. It's not real fair. But that is the reality that we have. And if there is no reform, I'm afraid that's going to continue as long as it can. But everybody is pointing to the fact that it's not sustainable. Something's going to give. Something's going to break down. And I'm afraid that the uninsured today are being marginalized, they're ostracized, they're packed and pushed into various alternatives that are not quality. For instance, the ED. The emergency department is the primary care for many, many people. I would say that it's an important part of healthcare delivery, but it's not the ideal for primary care, for health. We see an overcrowding of most emergency rooms across the country, and that is certainly here too.
Obviously, what Mr. Johnson said is correct. If someone has an emergency, they go to the emergency room, they have to be taken care of here. My concern is we still haven't really said anything about the population of folks here that are illegals. No one wants to look at it, no one wants to talk about it, but every day millions of dollars are spent with folks coming through the ER and being taken care of. I think they deserve care too. How it's going to be addressed has to be, we have to address it. I'm not saying everyone should become citizens, but something has to be done to allow the folks who work here but do not have citizenship to somehow buy into the system, pay into the system, and allow them to get care and get good care and not have to come to the ER for their primary care every day, because we still have that issue. It's an issue that's being kind of brushed aside, but it has to be dealt with no matter what.
I think the short answer is that the care mandate is threatened. If we don't have reform, if we keep going the way we're going, putting more and more burden on points of provision, we won't be able to continue to require that points of provision provide care to uninsured people. The money will simply not be there. To address the illegal issue, it's primarily a political problem, not an economic problem, because those people are already paying into the entitlement system every month in their paychecks, which they will never receive the Social Security or Medicare benefits. So that money is flowing in from their paychecks as it stands now.
Unfortunately, a lot of those folks aren't paying with a paycheck. They're paid under the table. They're paid in cash dollars, and God bless them. Most of these folks work very hard, but they're if we mandate that they get health care and keep the system the way it is now, obviously it's going to be more attractive for more folks to come in. And it's going to take more time away from the folks who are paying into the system, as with the school systems. So I want that to be dealt with too. I want these folks to be taken care of, but I want them to buy into the system. I want them to somehow get a number. I don't want them to become necessarily citizens, but they have to buy into the system, and they have to pay into the Social Security system, because most folks don't. They get paid in cash, and then they go to the ER for their cold and for everything, and it costs zillions of dollars to pay for it. And I want them to get care like everyone else, but we have to develop a plan for that. Right now, I don't think this plan addresses that.
Or we can move on to the next question.
I just wanted to comment on that. One, this is the United States of America, and we're talking about 46 million of our own people not covered who are working, and that's unconscionable. The next thing is we've always had immigrants in this country. However, this particular group has been held at a demarcation of denial for everything. And it's our own companies that are responsible for this. I don't think the bill addressed this, and I agree with you, but I'm just saying this is a humankind issue that we're dealing with here. We are quick to go to other countries and tell them that what they should do with their populations and they're being inhuman and on and on and on. And here we are doing exactly the same thing. So, I'm with
you. Next question, and I think this will be one for you too, Joe, at least to start with. Effectively, property owners in Florida have a hospital authority bill, a line item on their tax bill. Should I want to word this correctly, should a mandate of either insurance or a public option come into play, what do we see happening with hospital authority dollars? Does that essentially go away, or does it have a major reduction, or how will that work?
Well, there is still, within these bills, my understanding is that there is still a lack of 100% coverage. There's still probably at best 90 to 92% coverage, which is a substantial improvement. But there is still a gap with those who are eligible and able to access it for one reason or another. Either they're not eligible or they choose not to. Will that require health authorities to go away? I don't know. That's a good question. I think if we can get to 95% coverage, I think the need for a taxing district probably does go away from a hospital perspective. There is if we can equalize a lot of these payment structures for those who have insurance and those who do not have insurance, so that it is not a total burden on the taxpayers to do that, I see a substantial reduction in the need for that special taxing district.
And that's my question, Joe. The reason I ask that is because a lot of people in general don't really pay attention to how much they're paying into these hospital authorities, these taxing districts, if you will, to help indigent care. But that's a big chunk of money that we're paying in that possibly could be reduced or eliminated